as working editor for the prestigious Indian Journal of Medical Ethics. He's been doing this since 2014, and he also consults the World Health Organization for developing ethical guidelines for public health surveillance, and also developing curriculum for training in ethics and implementation research. Vijay.
Thank you, Chair, for the introduction. I would like to begin by thanking TDR and the organizers for this opportunity to present here. Before I start the presentation, a couple of disclaimers. One, this is not going to be a very comprehensive exposition on ethics of implementation research. For want of time, I'm going to be covering only a few key aspects of ethics of implementation research. And two, for the purpose of this course which we have written and developed, and for the purpose of this presentation, we will be looking at, we'll not be going into the intricacies of differentiating between research and non-research when it comes to implementation research. What is research? What is the difference between quality improvement and implementation research? That we are not going to go into the details, because irrespective of whether it's called research or non-research, there are obligations to conduct it in an ethical manner, and therefore the presentation as well as the course assumes this as the background before going into the details. So this is a course which has been developed by TDR, and I was part of the team which wrote this course. And the course has been launched just 2 days ago on 28th. It's hot from the press. You can see a copy of it displayed in the booth outside, the TDR's booth. And so this course has been in development from 2016, and multiple piloting have been done of this course. And the course comprises of 6 modules. The modules are spread over 2.5 days. It's a 2.5-day course. And the course looks at various aspects of ethical considerations in implementation research. So for this presentation, I'll take a case study and run through certain ethical considerations in this case study. This is a case study which you can see in the course as well. So this is a German technological organization which is developing an mHealth application for frontline health workers in Bangladesh to use. And they want to do an implementation study to see if this mHealth application improves delivery of maternal and child health care services in a district in Bangladesh. So these are the various elements that this IR will be looking at. First, it will look at social and contextual factors such as poverty, gender, culture, environment. It will look at in the cultural context, in the gender context of this district, will the mHealth application work as well. It will look at the process of implementation. How should this mHealth application be rolled out? Should it be just collection of data from the pregnant women and the newborn children using the mobile systems, or should it be text messaging to these mothers about health promotion messages? It will also look at outcomes of implementation such as clinical outcomes, reach, access, equity of service delivery, and this is how the implementation research has been planned, and we will reflect on various ethical issues in this implementation research. So this is the detailed description of various ethical considerations that you can see in the course, but I'm not going to go through the various ones listed here. The ethical considerations have been divided into those that are key in the planning phase of the research, those that are important in the implementation phase, and those that become important in the post-research phase. The first issue that I would like to highlight is the issue of clinical equipoise. When you look at randomized control trials, the concept of clinical equipoise is very important, in that there should be a genuine uncertainty between the two interventions given to the two groups. Which one is better? There should be an uncertainty about which one of these is better, so that you are not unethically depriving of the control group of an proven intervention. In implementation research, this does not happen, because implementation research uses proven interventions. It uses interventions which have been shown to have effect in previous studies. Therefore, we do not have this condition of clinical equipoise, rather we have what is known as contextual equipoise, which is this proven intervention, will it work in this context? Will it work in this place where it is being rolled out? So that is a difference between a routine research, health research and implementation research, which needs to be kept in mind while evaluating these projects for an ethical review. Then the other one is designs. Yesterday, during the opening plenary, Professor Spiegelman had referred to the quantitative design methods and how ethics of these methods becomes very important, and I would like to touch on the same issues here. The design of a good implementation study has to balance between autonomy, justice, equity as well as scientific rigor, and this balance sometimes becomes extremely difficult. The stepped wedge design about which we've been talking from yesterday is a very, very good design because it balances these four ethical principles by not depriving any group of a proven intervention. So that is an advantage of using this design from an ethical perspective. Quasi-experimental designs with no control groups are also helpful because they overcome the issue of having a control group where a less effective intervention is given. Effectiveness implementation hybrid designs are also useful because they do not require a separate study for the implementation. They hybridize both the effectiveness and the implementation components in the same study. Now, stakeholder and community engagement is very important in implementation research for multiple reasons. We will look at why stakeholder and community engagement is important. It is a core ethical principle because to understand priorities and being responsive for the needs of the community engagement becomes important. And it helps to buy in the support of the government, the support of key policymakers, and it helps to gain commitment for scale-up and sustainability. So this commitment is important because otherwise the goal of the implementation research is not met, and for that stakeholder engagement becomes very important. And the community and stakeholder engagement helps promote acceptability, maximizes utilization of the intervention, and also takes the intervention to marginalized communities and to vulnerable participants. And this is why community engagement and stakeholder engagement has been articulated as a very important ethical principle in implementation research. Again, understanding the benefit-risk balance in implementation research can be quite challenging because one, the safety and effectiveness of the intervention as such has been established earlier. But here it is the context which is important. And let us take the example of the mHealth intervention in Bangladesh. Now, it is well known that in certain cultures, a health worker walking into a household with a mobile phone trying to capture information could be seen as threatening. It could be perceived as something which is not acceptable in the community, especially in the culture of, in the era of cyber stalking and taking pictures and uploading on websites, etc. So in that context, it could prove to be harmful in that community, meaning the intervention may prove not to work in the community. So understanding these risks has to be highly contextual. And not only that, health system research, implementation research usually has, the risks are usually unpredictable and difficult to anticipate because health systems are complex adaptive systems. There could be emerging phenomenon. Like for example, if a health worker is frustrated with using, she's not tech savvy, so she's frustrated with using the mHealth application, this frustration could reflect on her overall service delivery and therefore it could have ramifications on other services that she is delivering. So the risks and the benefit assessment could be complex and unpredictable. This needs to be kept in mind and it has to be analyzed when the implementation research is being evaluated by the ethics committee. Then the other important challenge is informed consent in IR. This was again alluded to by Dr. Spiegelman yesterday in her opening plenary. And the informed consent in IR is complex because there are multiple participants, multiple layers of participants in the research. There are health system providers, there are community members, there are other stakeholders who provide information, and many times the implementation, the people on whom the implementation is implemented are very different from people on whom the data is collected. And so there are multiple stakeholders, multiple participants involved. So informed consent has to be thought of at multiple levels. Not only that, there are some public health interventions which happen at the community level and some at the individual level. Now, if you consider this mHealth application, the health worker is using the mobile phones for delivering the services in a community among pregnant women. So the pregnant woman does not have a choice to say, I do not want an mHealth application, because that's the service that is offered in the community. So it's a community level intervention. On the other hand, the woman has a choice to give her data or refuse to give her data for the study. So there are those kinds of complexities which are very, very prominent in implementation research. And you can look at spectrum of informed consent choices that are available in implementation research. There could be complete waiver of informed consent if it is a community level intervention, and there could be no option of meaningfully refusing to participate. Like for example, doing a fogging operation for mosquitoes in a community where an individual may not have a choice to refuse to participate. And on the other hand, there could be, moving along the spectrum, there could be permission from gatekeepers and consent from community representatives and gatekeepers. That could be one option. And at individual level interventions, there could again be individual level consent, which is the most rigorous form of informed consent, and there could be a two-stage consent process, where one stage of consent is at the level of the gatekeeper who gives permission considering the implications of the study for the community, and the other level is the individual consent, where the consent is given by the individual who is participating in the study. So informed consent considerations in IR are quite complex, and these need to be articulated differently compared to routine clinical trials and public health research. Then the other important issue that comes up, important ethical issue that comes up in implementation research is ancillary care responsibilities. Now take the same case study of mHealth intervention in Bangladesh. There is one remote village where there is no electricity supply. There is no power supply, has not reached that village. So the health worker does not have an electrical port for charging her mobile phone. So this could be an ancillary care discovery as a part of the implementation study. So what is the responsibility of the implementation researcher? Should the researcher make sure that electricity supply is brought to that village? Is that something which is feasible for the researcher to do? Or what is the role of the researcher? What is the responsibility of the researcher? This can be looked at from the severity and the urgency of the need, of the ancillary care need. If it is something which is life-threatening, if it is something which is life-saving, then the severity and urgency of the need is so high that one could articulate it as something which is an ethical obligation on the part of the researcher. Whereas if it is something which is not of such immediacy, then it could be discussed and debated by the ethics committee. Ancillary care responsibilities are often unraveled in implementation research that is conducted in low and middle income countries, especially because care may be expensive, access may be a problem, and system level issues and inefficiencies may be operating. So these needs to be kept in mind while planning an implementation research. And then post-research phase, when once the, implementation research actually never gets over, but if it is a funded research project and one part of the research is over, there is an ethical obligation to disseminate the findings of the research to the community, back to the community, as well as to the scientific world, as well as to the public health community. This is because unnecessary research should not be done when something is already established. This was again spoken about yesterday in the opening plenary. Research should not be done which is already established and which is very well known. And then negative findings should also be disseminated if a certain implementation, if a certain intervention is not feasible in a certain context. Even those findings are important and need to be disseminated. This post-research dissemination of research findings is useful for scalability and sustainability. It is useful for advocating for scaling up of the research findings. Okay. In conclusion, implementation research is an ethical obligation in low resource settings from justice perspectives. There is an ethical obligation to conduct implementation research to see how effectively an intervention can be taken to the community and how effectively it can be scaled up. It has unique ethical challenges, only a few of which I have presented here, but more details are elaborated in the 2.5-day course which has been released. There is a need, there is in fact an urgent need to build research capacity, ethical capacity among IR researchers as well as institutional ethics committees, because evaluation of implementation research protocols is going to be an emerging need in the near future. And there is a need for building this capacity to review IR protocols, keeping in mind the unique considerations of ethics in implementation research. This is a publication which emerged out of the work of TDR and the group of us who wrote the course. And this covers all the details of the ethics of implementation research. So you're free to please go through this publication, as well as please stop by in the TDR booth to take a look at the facilitator module as well as the participants module of the course that has been developed. Thank you.